Thank you, Dr. Rafi Pristoop, and thank you so much to the National Physicians Alliance for supporting the public option and speaking out and bringing their word to all of us out here at gatherings like this across the country. So right now in Washington, on the floor of the Senate is this second bill. And it's important that we understand we're not going to get everything we would like. It's a historic change, and change happens slowly. But some of the options that are not really an option, triggers that would wait for the financial statistics to get worse, I think they're bad enough. A healthcare system that would be run by a nonprofit rather than a public option, not really good enough. Some people say that the White House is not working hard enough right now, that they're not pushing hard enough. That Obama could insist that the bill would go through a reconciliation process if it doesn't surmount a filibuster. He could do that. He could also make it clear to senators who support a filibuster that they could lose their chairmanships in committees. Yes. And we can speak out and let them know that. That's why we're here tonight. It's also that possible that President Obama could withhold his charisma on the campaign trail from senators who support a filibuster. So there's more options. There's more leverage. It's not over yet. We know it's bad, and we've got some momentum, so we need to keep on it. We need to keep speaking out, and we need to keep moving. I'm considering how cold are we? I'm wondering if it's time to call it quits, or is there anyone out there who would like to speak, tell us a personal story? Come on up.
Hi, good evening everyone. I have a question. In your opening statement, you refer to the fact that we need to compromise, and I've been hearing that a lot. There was no compromise on Iraq. There was no compromise on the bailout of the financial sector. The 3 pages that were taken up there. Why are we being asked to compromise when it comes to one of the most important issues that face every American, that of healthcare? I'm a self-employed person. There are so many self-employed persons who can talk about the fact that they cannot afford healthcare and have to do what Dr. Rafi say. When you feel some pain, try and ignore it or self-medicate until such time as you have no option but to go to the hospital and seek help. Why should we compromise on this issue? That's my question.
All right, good question. Good question. Bernadette?
Hi. As somebody who you might be able to tell is self-medicating right now because I don't have health insurance, I totally understand that point. There shouldn't be. I don't think there should be any compromise. There should be no triggers. There should be no opt-outs. There should be no co-op. There should be no buy-in at 55 to Medicare and have insurance companies acting as non-profits. No, we need a public option. It's been worked out. It's there. It works around the world. A system much similar to that. Why shouldn't we have it? And so I really want to push all of you to keep calling. We have flyers here tonight with the numbers of Senator Gillibrand, Senator Schumer, and the White House call number. Call the senators. They are in committee right now discussing this. Call them. Let them know this is not acceptable. They have to keep pushing for a strong public option. Schumer got up on his pedestal and he told us he was going to do it. Well, he needs to follow through. And we're not going to continue to support somebody who doesn't do what they said they were going to do. And the same thing with President Obama. I supported him all throughout his election. I was really excited when he won, and I want to see him follow through. He has to stand up and give the support back to the public option where it belongs.
Yeah! Woo! Thank you, Bernadette. That's Bernadette Walker. Bernadette is the district manager for Move On. District manager, is that correct?
Something like that.
Something like that. Is there someone else over here? I saw you raise your hand. Come on up. I want to thank so many people for coming out today. Swiss Chris for coming out and providing some groove for us.
Everyone,
it's the Move On Brooklyn Council cost of delay vigil. Come on up. Come on up.
does all the money go to in this country? For the most part, it goes to the military. And over 700 billion is for the military. And many other things are only under 10 billion. 10 billion seems like a lot of money. Certainly 8 million seems like a lot of money to me. But 10 billion is really not in this huge country's economy. And with 700 billion going to military, that is partly why we haven't got better health care already. And we have to fight that.
All right, thank you very much. Thank you to so many people, to everyone for coming up and speaking out on this issue. Stay tuned, keep abreast of what's going on in Washington, and keep speaking out. I want to thank again the representatives' offices that were represented here tonight. I want to thank Ellen Rios for all of her contribution with signs and coordination and making stuff come together. Swiss Chris has an organization called SwissOrg.org, speaks out on human rights. He's here tonight representing human rights and healthcare as a human right. Healthcare is a human right in this richest country in the world. Thank you, everybody.